Tarsal tunnel syndrome is a neurovascular issue that you will see in various patients. It really involves the compression on or an entrapment of the tibial nerve or one of its branches in the tarsal tunnel. The tibial nerve divides distal to the medial malleolus into the medial and lateral plantar nerve. Tarsal tunnel syndrome is going to occur when the diameter of the tunnel is smaller due to some type of internal or external pathology that puts pressure on that nerve. So the tarsal tunnel itself consists of several different structures. The floor is made up of the tibia calcaneus and talus. The ceiling is that flexor retinaculum that runs over the top of the tendons and nerve. And so the contents of that tunnel include your flexor digitorum longus, flexor hallucis longus, your posterior tibial artery, and the tibial nerve. This space is very inelastic. It is a fixed space, so any inflammation is going to cause pressure on all of those structures, but especially that nerve. Many different things can cause tibial tunnel syndrome. If there is acute direct trauma to the area and you have inflammation, that's going to put pressure on those structures. Anatomically, it is most often seen in individuals who have pes planus, but you can also see them in pes clavus. They may have a rectus foot, they may have a ganglion, or a tenosynovial cyst that is in that tunnel as well. You will also see in individuals whose footwear consists of tight shoes or a lot of high boots or high heels. Diseases can cause the problem, such as rheumatoid arthritis. Pregnancy can exacerbate issues there. And then you can have errors in your training, your DIF, distance, intensity, and frequency. Any of those errors can actually exacerbate other etiologies that occur. Signs and symptoms. Generally speaking, because it is a nerve type injury, there's going to be numbness, paresthesia, burning, all at the medial malleolus, but that will also radiate to the sole, the heel, and even up the leg. If a person is running and they have a lot of ankle dorsiflexion, it oftentimes can make it worse. You'll also see localized edema in the tarsal tunnel, pain or numbness in the arch that radiates to the medial ankle, posterior medial ankle pain, as well as heel pain that is exacerbated with activity and relieved with rest, point tenderness over the tibial nerve, and the individual may complain of nocturnal pain. Active range of motion tends to be within normal limits, but you may have pain present with terminal range of motion. Forced dorsiflexion may increase the pain during passive range of motion. The special test that we will use, the nerve test Tunnel sign, is pretty common to recreate those symptoms. There is also something called the dorsiflexion extension test. It is a type of provocation test. So we are trying to recreate those problems through passively dorsiflexing and everting the ankle all the way to the end range while maintaining the metatarsal phalangeal joint in full extension. This needs to be held for about 10 seconds to recreate those symptoms. You will find that there is weakness of the tibial nerve muscle intervention, so the foot intrinsics and flexors may be weak. Treatment is going to come after a diagnosis that usually consists of nerve conduction studies. That treatment will be things such as a conservative orthotic or corticosteroid injection. If that doesn't work, there may be a surgical release of the flexor retinaculum.